Thank you very much, Stephanie. I'm Irina Todorova, and I'd also like to welcome everyone to the webinar. We're very excited about this webinar. And first of all, I'd like to introduce our speakers. We do have two presenters today, and they have been conducting research in the area of workplace coaching, generally for health and well-being, and both of them have received the Harnisch grants from the Institute of Coaching, so they'll be presenting today basically about the research that they did with this Harnisch grant, as well as reflecting more broadly on that research. They both conduct research, and their presentations, as I mentioned, will focus on those research projects, but also with reflections on implications for coaching practice. So we will have about a few minutes after each presentation so that you are welcome to ask questions or comments for each presentation individually after it's been presented. But we will also have a chance to address some intersecting issues, both about the research as well as translation to coaching practice after our second presentation, which will have 10 or 15 minutes at the end of the webinar also to talk more broadly about the issues that have come up. And if we can get to all the questions that during our webinar, we do have a record of them, and we will can get back in touch later on. So without taking more time up, I'd first like to introduce Dr. Alyssa McGonagle, and who is an assistant professor of industrial and organizational psychology at Wayne State University in Detroit. So she received a Harnisch grant from the Institute of Coaching in 2011 to conduct a study of the effectiveness of coaching for individuals who are working with chronic health conditions. Her broad research focuses on individual and workplace factors that affect workers' health, safety, and well-being, and her work, both from the Harnisch grant and more generally, has been published in Journal of Applied Psychology, the Journal of Occupational Health Psychology, Journal of Business and Psychology, and others. So please join me in welcoming Dr. Alyssa McGonagle, and Alyssa, we look forward to your presentation.
Great, thank you, Irina, and I'd like to take a moment as well to give thanks to the Institute of Coaching for funding this study through the Harnisch grant mechanism. And I'd also like to thank my co-authors on this project, Dr. Joy Beatty from the University of Michigan Dearborn and Rosalind Jaffe from cicoach.com. Okay, so by way of background, I'd like to take a moment to define chronic illness and chronic pain. So what I mean by that, chronic illness, according to the World Health Organization, is not able to be resolved. It's long-lasting, usually permanent. It requires some management. So for instance, via medication, doctor's appointments, medical treatments, therapies. And due to those characteristics, sometimes chronic illness and chronic pain brings up issues for workers who are working. And so the goal of this study was to explore some of those issues, but also to see if coaching could help with some of those issues. So I outlined some of those potential issues here, such as experiencing or anticipating work discrimination on the basis of one's health condition, managing a professional identity in light of having a chronic health condition, managing health-related symptoms at work, something called work health conflict, which refers to when an individual feels like managing their health and doing the things that they need to manage their health conflicts with their work, or vice versa. Their work is conflicting with their abilities to manage their health in the way that they want to. Communicating about their illness with their supervisors and coworkers, perhaps attaining accommodations when one needs accommodations for disability, managing a career when thinking about health limitations, both current and or future, and maintaining workability, which means an individual's perceptions of their ability to continue working in the near future, and also their job performance. So in light of these issues, my colleagues and I proposed that coaching could be a good intervention for workers, and our theoretical framework for that was using stress appraisal theory from Lazarus and Volkman. And essentially, we thought that the challenges of working with chronic illness and pain could lead people to feel burnout, high levels of stress, and even perhaps make them want to leave the workforce. And so we thought that coaching could perhaps build upon personal resources, and these personal internal resources could help individuals deal with the stressors that they're facing, or perhaps even lower those stressors to begin with. So we proposed that perhaps these increased resources such as resilience, including the ability to cope or the ability to persevere in the face of stressors, and self-efficacy or confidence in one's ability to continue working, would lead them to have alleviation of negative things like burnout, and also improve their perceptions of their abilities to continue working. So to give you an overview of what we were proposing for the intervention, we were doing a 6 one-hour phone-based individual coaching session engagement over the course of 12 weeks, so about one session every other week. And we chose to do them over the phone on the basis of two main reasons, one being privacy and the other being convenience. So all of these individuals who were enrolled in our study were 30 hours a week, and many of them had difficulties getting time off from work in order to attend coaching sessions. So by doing it over the phone, it allowed them to do it during a break. Some of them went to their car during a work break to do it over the phone, and also for privacy reasons. So it was very important for individuals to be able to not disclose to their supervisor that they were partaking in this intervention, because doing so would out them as an individual with chronic illness. So by doing it over the phone, we help them achieve that. In terms of the structure of the coaching engagement, we first had them complete an intake form, which asked them questions about their work, about their health, and their problems related to working with chronic illness. So as I'll mention in just a moment, any individual who came into our study was an individual who identified themselves as specifically having a problem relating to working with their illness. During the first session, the coach and the client co-identified goals for coaching, and that was on the basis of what they reported during their completion of their intake form. And one example would be being better able to communicate with my boss about my illness-related needs. For each subsequent session, in general, these bullet points just talked about the general philosophy of the coaching, which was that we focused on client empowerment. And we did that in a number of ways, but one of which was having the client set the goals for the session and identify their goals for coaching in general. The coach was involved with that, of course, to help them in terms of questioning and solidifying goals, but it was very much client-driven. We used what is referred to in the clinical psychology literature as motivational interviewing. In the coaching literature, I believe it's referred to as powerful questioning. We used a brief mindfulness exercise during each coaching session, and we had the coach returning to the goals for the engagement at the end of each session. And oftentimes the client would be given homework between the sessions, which differed depending on their goals and their issues that they were experiencing related to work and managing health. So that might include, for instance, journaling or reading specific literature related to chronic pain, for instance. The model of coaching that we used was the GROW model, which is based on goal setting, striving, and creating awareness. And this model, first of all, states the goal that the client wants to strive for, which I just mentioned a moment ago. Also increasing awareness of the current situation relative to the desired situation, identifying ways to move forward, and actually helping the client to develop action plans to reach that desired reality state. In terms of the study method, our inclusion criteria, like I mentioned earlier, stated that individuals had to have a problem related to working with chronic illness to be enrolled in the study. Beyond that, we required that they were working at least 30 hours a week and that they were not planning to retire within the next 2 years. In terms of recruitment, we initially had one health insurance organization on board to allow us to recruit from their large pool of employees. Unfortunately, our contact at that organization retired shortly after we started the study, and our recruitment from that organization subsequently wasn't as good as we had hoped. So we added 3 additional organizations, including 2 universities and a pharmaceutical organization to recruit from. And we also recruited through social media, primarily Twitter, but also some online blogs from individuals who are prominent in the area of working with chronic illness. We had 78 individuals initially contact us who were interested in participating in the study, and after learning more information about it and being screened for the inclusion criteria, we enrolled 59 individuals in the study. In terms of the participants, individuals were fairly young, generally well-educated, and mostly female. And we randomly assigned individuals into 2 groups. So one group was an immediate start to coaching. They would start coaching within 2 weeks of being enrolled in the study. And we had a waitlisted control group. So that group was able to do coaching, but not until the immediate start group ended. So we waitlisted them for a length of 3 months, which was the same time frame as the intervention itself. This flow chart shows the progression of participants through the study. And you can see there going down the left-hand side is the flow of the immediate coaching group individuals. On the right-hand side is the flow of the lagged coaching individuals. And you can see from this diagram that we surveyed them at time points. So we surveyed the lagged coaching group immediately and the immediate coaching group immediately. So that would be the start point for the immediate coaching group. We also surveyed the lagged coaching group when they started coaching. Everyone received a survey halfway through coaching. Everyone received a survey at the end of coaching, along with an exit interview. And everyone received a survey 3 months after coaching ended. This slide gives you some examples of the types of jobs and the types of chronic conditions that individuals were dealing with in our study. This is not an exhaustive list, but I just wanted to provide some frame of reference for the types of jobs and the types of chronic conditions that we were dealing with. And you can see that it was pretty diverse in terms of the types of chronic conditions that were represented. We did not restrict the type of chronic condition that we would include in the study, and we did not restrict based on physical versus mental conditions. In terms of the variables that we studied within our survey, our outcome variables, I separated them on this slide in terms of resources, which if you remember from earlier on, we proposed would be improved by coaching and would help decrease the strain that individuals would feel. So the resources that we looked at included first, job self-efficacy. So this would be individuals feeling confident in their abilities to work, capable of handling problems at work. Their core self-evaluations, which refers to their evaluation, their fundamental evaluations about themselves, their abilities, and their control that they have over their lives. Resilience, which refers to their ability to bounce back and recover from setbacks and persevere to achieve their goals. And something called mental resources, which refers to having hope for the future, enjoying daily activities, and having energy to get things done. Now, in terms of the strain-related variables that we looked at, we examined exhaustion, burnout, work engagement, perceived workability. So again, that's an individual's perceptions of their ability to continue working in their job, and also their satisfaction with their job. Other variables that we looked at, some of them were control variables, some of them we just wanted to know, were illness severity, psychological distress, your health status, various demographics, your reactions to coaching, and also the fidelity of the intervention as a coaching intervention. In terms of results, the 2 groups were equivalent on all study variables and the other variables that I mentioned at the baseline, which was very important for us to determine before we went ahead and looked at whether coaching had an effect on the study variables. And so our question of whether coaching did have an effect on the study variables, we tested using MANOVA, multivariate ANOVA, and a series of univariate analysis of variance. And we were specifically looking for time by group interactions. So this means that we wanted to see an improvement in these variables for the group that got coaching during the coaching time frame, but we were also looking for no improvement in those variables for the group who did not receive coaching during the same time frame. So having said that, we did find significant positive effects of coaching on each of the variables that have a check mark in that list. So that includes core self-evaluations, resilience, mental resources, perceived workability, and exhaustion burnout. Now, we did not see any effects for two of those variables with X, and that's disengagement from work and job satisfaction. Job self-efficacy had marginally significant effects. So we did see an improvement for job self-efficacy. However, it was not as strong as the improvements in the other variables that have the check marks. We also tested for what we call indirect effects of coaching on burnout and perceived workability via those psychological resources. And essentially, this is a type of analysis called mediation where we can look at, does coaching lead to improvement in resources, and in turn, that improvement in resources lead to lower burnout and higher perceived workability. And we found that 10 of our 16 tested indirect effects were statistically significant. So in other words, coaching does seem to work, at least in part, by building those resources. We also looked for stability of coaching's effects over time. So this is looking at those results of the 3-month post-coaching survey for both the immediate and the delayed coaching groups. And we found no average differences between post-coaching surveys and the surveys 3 months later on each of the variables. They were all non-statistically significant, which means that we did find evidence for stability. In terms of attrition, so people leaving the study, we had a pretty high rate, I'd say, average for coaching studies though. So 34% of people left the study overall, 23% in the immediate group, and 44% in the waitlisted group. So higher in the waitlisted group. And we were unable to follow up with these individuals to find out exactly why they left coaching, but we might speculate that because they weren't able to start right away, they might have lost the momentum that they initially had, whereas the immediate group, if they felt a high level of coaching readiness, they were ready to jump into it and they were able to do that, and their momentum might have carried them through. In terms of looking at the attriters, they had lower levels of education, higher levels of psychological distress than individuals who did complete the study. Okay, so that wraps up one of the studies that my colleagues and I have done on just the general effectiveness of coaching for these individuals. We also conducted an additional study using the results of that same study, my colleague Joy Beatty and I, to look specifically at how coaching might help this population. So answering not just the did it help, but how might it help. So we had some information about, well, it seems to help their resources. So we wanted to look more specifically at this notion of biographical disruption. The idea being that chronic illness and the diagnosis of a chronic illness requires biographical work because it represents a disruption. And that coaching may help workers renegotiate or restore their professional identities in light of having a chronic illness. So our question was, how can this type of coaching facilitate their biographical work? And to answer this question, we had transcripts from 34 individuals who completed an exit interview with my colleague, Dr. Joy Beatty, and we had them transcribed and we analyzed them for their content. We found two major categories of work that was being done during the coaching sessions according to those transcripts. And one was internal work and the other was external work. And I'll talk about the internal work first. So the idea behind this is that in how individuals make sense of their changing identities and integrate those changed identities in their lives. That's this type of work that we're talking about. So it can be broken down into two categories, identity work and behavioral strategies. In terms of specific identity work, coaching helps people accept their illness, develop confidence around working despite having an illness, realizing their value as an employee, because oftentimes individuals had felt like their value as an employee had been greatly diminished, and realizing that they had some value was very helpful to them. And also establishing realistic expectations and goals for themselves in light of the type of illness that they have. In terms of behavioral strategies, we found that individuals were well served by understanding the illness dynamics, developing structures and processes to address those illness dynamics, and in some cases adopting assistive advices that they may have been really hesitant to consider previously, but would really help them improve on their workability. I have some quotes here from participants because I think that's really helpful in bringing the human side of this study to light. And these correspond with some of the categories that I just mentioned. So the first states, "It was the hardest thing going through the process of accepting my illness. I kind of felt like I was done with that and I had figured it all out. And the work I did with the coach helped me realize that I still had elements of that, both a sense of loss of that other identity and a sense of trying to keep up with the previous identity. Coach helped me see that my value as an employee doesn't necessarily need to be lowered because I'm a person with a disability. She started having me look at things I was accomplishing and the value I was giving for the time that I was available, and to see that as an asset regardless of how you counted the hours. Coach helped me realize that I wasn't paying attention to my body as much as I needed to, and helped me learn how to cope with that." So the external work that I mentioned refers to how individuals manage their image and their professional identity as seen by other people. So rather than it being internal identity work, being more external work. And there were two main categories, one being impression management, around how they are managing their identity as a person with an illness in the workplace, whether they're disclosing it or not being one aspect of that, but there were certainly many others. And also communicating about their illness. So improving their communication skills, understanding disclosure was a big one for many individuals, and learning how to ask an accommodation or deciding whether or not they needed to ask for an accommodation. So this participant said, "A main benefit was developing the capacity to know when and what I need to be able to tell somebody about my chronic illness," and we worked with the model. "Now I've got it that I don't need to disclose what the actual disease is. That is where I always got hung up. We talked about in certain situations providing less information and in other situations providing more." Okay, so in terms of next steps for this line of research, I am planning to refine and extend the current intervention, and I'm proposing a two-phase study. I'd like to refine and standardize the materials so that it can involve multiple coaches in a future study. This particular study only involved one coach. I'd also like to create an online component to help house some of the coaching materials and facilitate progress through the study itself. And test the new intervention or the refined intervention using a randomized control trial. I think going forward, more formally addressing the pain component would be important, because almost all of the participants had pain as a common side effect of their illness or a common symptom that they were referring to. And also eventually extending from their perceptions of their ability to continue working to actually see if coaching could potentially delay or prevent early leave from the workforce due to work disability. Okay, and so I'll wrap up with a brief discussion of implications for coaches, what I see as the implications, and I'll certainly welcome any additional discussion or questions after as well. But the way I see it, individuals working with a chronic illness or chronic pain face very specific challenges, and although there might be big differences in the types of illnesses and pain that individuals are dealing with, there do seem to be these common core issues around working and managing health issues that coaches should be aware of and potentially integrate into coaching when they are coaching an individual who has some of these issues. Coaching does appear from this study to be helpful for people working with chronic illness or pain for improving particularly their personal well-being. And as you may have noted when I went through the results, there weren't as many positive results for the work-related variables. So that's kind of a lingering question. Do we need more time to realize benefits, to translate from personal well-being to work-related well-being, perhaps? I think future studies should follow coachees for a longer period of time. The third point being that coaching appears to work for individuals who are working with chronic illness through two main mechanisms. First being they're boosting their personal resources, such as their resilience and their core self-evaluations. And the second being through addressing issues related to identity, that internal and external work that I mentioned. I think future research related to this should look for additional mechanisms as well to help us better understand how coaching is working. And finally, there might be questions around the issues of sponsorship of coaching. So is this the type of coaching that individual companies will want to pay for their employees? And perhaps that could happen through a mechanism such as an EAP or an employee assistance program. I think it's a little bit of a question mark right now, particularly since we didn't find as much support for the work-related variables as we did for the personal variables. But I'd welcome ideas and future discussion related to that topic. So thank you. I can turn it back over to Aruna now for questions.
Yes, thank you so much, Alyssa. Thank you for a very interesting presentation and really focusing on the work that you've done through the grant and actually how that has also continued into other studies and has been a springboard for other studies that you've conducted and are also planning to conduct. That was very to hear, and especially such an important topic that you are addressing in terms of chronic illness, people with chronic illness in the workplace, because we probably don't, employers and in general, we probably don't think of that much, but as people are working longer and longer and as chronic illness is being managed better through the different stages of that, I think really that's an important issue to address and especially consider how we can contribute with coaching to address those issues and many of the considerations that you addressed. So thank you so much for that, and I'd also like to invite everyone to send questions for Alyssa. We do have several questions coming in that I will read, and Alyssa can address and we can discuss them. So Alyssa, one of the questions is, one of our participants is interested in your thoughts on the difference between male and female enrollment and differences in male and female subjects in terms of the outcomes, and have you thought about the gender differences in these in what you've been doing?
I think that's a great question, and I wish we had more male employees in our study because there were so few of them. I think there were only about 5 total. And it's really hard to say whether or not we have any differences because that male group was so small. I think in the future I would do a lot more work to try to get an even representation of men and women in the study. I think there might be a couple reasons why we ended up with that type of a sample. One is that chronic illnesses, like the ones that were highly represented in our study, tended to be things like fibromyalgia and MS and rheumatoid arthritis and spondylitis, and a lot of them can be considered autoimmune diseases, which are more highly represented by women than men in general. So that could be one thing. It could be something that perhaps women were just more drawn to participate in something like coaching. I'm not quite sure, and I'm afraid I can't really give a great answer to that, but I definitely agree that it's a great question for future research.
Mm-hmm. Yeah, thank you so much. And one more question. What are your thoughts on how coaching can be most effective when there's a language barrier, even when interpretation is available? Also from one of our participants today at the webinar.
Oh, that's another great question, and I'm afraid I don't have a really good answer for that as well. In this particular study, we got everyone was an English-speaking worker. Everyone was from the U.S. I think we had one person from Canada and one from the U.K., but in general, everyone fluently spoke English.
Mm-hmm.
That's a great question. You know, but I unfortunately don't have a great answer for it.
Okay, and there are more questions coming in. I think we'd leave the other questions for our general discussion after both presentations, as well as I mentioned, we can get back to, we have the record of the questions and can be in touch with you, with the participants in the webinar later on after our webinar. So thank you so much, Alyssa, for a wonderful presentation. And now we will continue with Dr. Sforzo's presentation. And I'd like to introduce Dr. Gary Sforzo, who is a professor of exercise and sports sciences at Ithaca College in Ithaca, New York, and his research focuses on wellness programming. He actually also received the Harnisch grant in 2011, and his project was the effects of wellness coaching on health behaviors in an employed population. Dr. Sforzo is trained as an exercise physiologist and holds certifications as an exercise specialist as well as a health and wellness coach, and he's a fellow of the American College of Sports Medicine, and his publications have also appeared in many journals. The study that he'll be talking about is now in press in the Journal of Occupational and Environmental Medicine. So, Gary, I'd like to welcome you and look forward to your presentation.
Thank you very much, Irina. I need to make a quick correction. This particular study that I'll be talking about today is currently under review and not in press in the journal that you mentioned. But we're sure hoping it's published real soon. So, thank you all. Thank you, Irina, and thank you all for being here. I appreciate you taking the time to listen in. And before I get started talking about the project, which I tend to call the Ithaca Coaching Project, let me first acknowledge some of the people that were absolutely critical to making this project happen. There would be nothing to talk about without my co-workers there, Miranda Kaye, Sarah Simonovich, and Frank McCauley. In addition, the Institute of Coaching, providing the Harnisch grant, was extremely useful and again, could not have done the project without their support. Additionally, on campus here, the Ithaca College Office of Human Resources provided all kinds of support, all levels of support, not only financial, but also planning and implementation support for the project. And the same goes for Well Coaches Corporation, particularly Margaret Moore and Blaine Wilson from that organization, who provided help at different times. Blaine, very important to logistics and helping us organize the coaches, and Margaret, important in helping us train the coaches. And then finally, I have to thank the coaches. There were 13 of them. They were excellent. They worked with us for almost 2 years, and we'll say more about them as we go on. But I hope a couple of them are in here listening today, and I hope they enjoy what they hear in terms of how their hard work pays off. So thanks to everybody, and let me tell you now a little bit about the project. Okay. Oh boy. Sorry about that, folks. I'll be right back with you. I always have to work with it this way. All right, I'm pretty much going to tackle this just as as Alyssa did, and as anybody would present a research project, in the sense that we're going to have an introduction to methods, or results, and discussion section. In the introduction, I'll give you as much background as I can about the project. I'll also tell you a little bit about Ithaca College and our employee wellness program, which are central to the project. Talk about some of the specifics of the methodology that we used. I'll present some of the results and some of the numbers that we came up with, and then hopefully try and interpret some of that information in a form of a discussion, and then also hopefully come up with some takeaway points. And I've got to change this slide one more time. Okay. There we go. And as I present those takeaway points, hopefully we'll have something that is useful for folks in coaching practice, as well as some information about workplace wellness and what we can extend from our study about workplace wellness programs, and then also maybe just some information about coaching research and how our results might actually help future research. All right. In the form of introduction, probably about 5 or 6 years ago, the Director of Human Resources, Mark Aldrin, and I got together and started talking about an employee wellness program here at Ithaca College. And Mark was a very forward-looking type Director of Human Resources and wanted to do something for the employee population. And we were able to really pull together a very large team of people, many partners, including one of our insurance providers, including the wellness clinic that's here on campus, including another fitness center that's here on campus as well, all to team up for this employee wellness program that was then branded, and you can see the little logo there for Mind, Body, Me. And it turned out to be a very successful program, and you'll hear more about the program in just a little bit. But the point here being a lot of partners and a lot of services that were going to be made available to our employees. About that same point in time, 5 or 6 years ago, when we were devising this Mind, Body, Me program, I also became very interested in wellness coaching. In fact, took the Well Coaches certification program, became certified as a health coach and a wellness coach. And just with these two projects going on in my life at that point in time, tried to mingle those together. In other words, how could I work with this employee wellness program they're developing and also continue to work in this new passion of coaching? And decided that research in coaching was really the way to go. And talked to the folks over in Human Resources about this possibility of making coaching sort of a centerpiece of the wellness program, and they were very excited about that possibility. And that's when I contacted the Institute of Coaching, applied for the Harnisch grant, and fortunately was awarded that grant. And we ended up starting the Mind, Body, Me program with that coaching element as a centerpiece of the program. And the project that was approved for the Harnisch grant and that we ultimately ended up conducting was a randomized and controlled trial to examine the effects of wellness coaching, health and wellness coaching, on the health impact of employees in this employer-sponsored wellness program. And I want to differentiate this RCT that we did from a lot of what you see in the health coaching literature, observational studies. You know, we thought we were going to take the field up a notch by doing a random and controlled trial, whereas what you tend to see are lots of observational studies. And observational studies are generally what's called quasi-experimental design studies, and there are measurements made before and after some intervention, a coaching intervention oftentimes. But what we're seeing in the literature previously and really to this day are lots of wellness programs or overall health improvement programs that include coaching as an element of the program. And what you see published in the literature then is the program was effective. And the program was effective and included coaching, therefore coaching was effective. But if coaching is a part of a larger program that might include, say, stress management or other educational pieces, or might include an exercise program as well, you really don't know when you go pre-post measurements if the improvement were largely because of the other aspects of the program or the effects of coaching. So we hope with this RCT to try and isolate the effects of coaching from all the other influences that the larger wellness program offered. So we're trying to determine if this health and wellness coaching enhanced health in our employees, and also want to take a look at different doses of coaching. And so the second purpose you see on the slide then is to find out if, in fact, various amounts of coaching might have different impacts on the health and wellness of our employees. So how do we do this randomized and controlled trial? Well, first of all, we offered on campus an invitation to anybody who wanted to join the Mind, Body, Me Wellness program, of which coaching was a part of. And over the course of 2 years, we had well over 300 participants who came to accepted our offer. And our final sample included 272 participants. Coincidentally, this goes back to this study here, most of whom were female. So mostly female accepted the Mind, Body, Me Wellness program, and therefore were in this coaching study. When I say mostly, it was about 3/4 of the participants were women. All were employees, all were able to speak English, and all had access to a computer and a telephone, because that was what was necessary primarily for the coaching aspect of the project. The design of the project is pretty much shown to you on the slide here. If you look at the flow chart on the right, you can see that the primary aspects of the design were to have 3 different coaching groups and 3 different levels of coaching. One group received weekly coaching for 3 months. A second group received weekly coaching for 3 months, and then bi-weekly coaching once every other week for the following 3 months. And then the third group received weekly coaching for 6 months. So 3 different lengths of coaching programs, 3 different doses of coaching, and then the fourth group over on the right side of the figure there was the control group who received no coaching. But I ought to point out to you now, and this will become more relevant as we go forward here, that the group that did not receive coaching was a group that did receive all the other Mind, Body, Me benefits. So they were eligible for exercise programs, stress management programs, and lots of other benefits that were being offered. They, however, did not speak to a coach on a weekly basis, whereas the other 3 groups did. And we had equal numbers of participants spread across those four groups. What we did was do assessments at baseline, and we did then assessments also at every 3 months after that for the whole year. So we had 4 sets of assessments. However, I'll only be reporting today on the baseline 3-month and 6-month data. We collected data in not only the health area, so we did a health risk appraisal, a fairly extensive one that had a nutrition component to it, also had a component that asked about exercise habits, levels of stress in folks' lives. So it's a fairly extensive health risk appraisal. Then also a biometric assessment where each participant came in and we did body weight, blood pressure, blood testing for cholesterol, blood testing for glucose, and some fitness measurements as well. I'll be reporting on most of those measures today. However, we also had some questionnaire analysis. We had a psychological battery of tests that included not only looking at stress levels and depression levels, we also had questions about motivation, and particularly autonomous motivation. And then we also had another questionnaire that got some employee type variables, again, as Alyssa was defining. But we looked at presenteeism, which also sometimes is defined as productivity. We looked at employee morale. We also looked at job satisfaction. And so we had this group of employee type variables. Again, those won't be variables I'll be talking about today, but we hope when we look down the road in the future, these as additional presentations that we can work with. Data analysis, we did 3x4 analysis of variance, repeated measures analysis of variance, and we also did a secondary type analysis called latent growth curves or latent growth models. This is where you look at sort of the slope of change that occurs and the rate of change that occurs in different variables. And so I'll talk a little bit about those analyses as well when we talk about the results. It's probably important that you all know about the coaching intervention that we used. And we pretty much wanted to do something that was compatible with a systematic definition of coaching. And I worked on a project with Ruth Rollover and the folks at Duke on defining coaching, and we did an extensive survey of the literature, of the coaching literature, and came up with a systematic definition of coaching that pretty much defined coaching as a patient-centered approach that involves goal setting, particularly by the patient has to be involved in the goal setting process. It's an active learning process for the client or the patient. It's something where the coach and the client develop an interpersonal relationship, and the coach themselves are someone who has a background in healthcare. They have been trained in behavior change and motivation. They've been trained in communication skills. And so we wanted to have this definition for our coaches. And again, fortunately, I was able to partner with the folks at Well Coaches, and their model very much fits that definition that I just described, that we published in this systematic review that we had done in the coaching literature. And so we used Well Coaches as our primary tool for training our coaches, and all of our 13 coaches had background in training from Well Coaches, and then they also went through a secondary level of coaching training where we had actually 12 weeks of 90-minute sessions once per week with somebody with a senior instructor, oftentimes Margaret Moore herself, presenting for us over those 12 90-minute sessions. And in those sessions, we emphasized some things that we really wanted the coaches to work with our employees on, and those were things like autonomous motivation, positivity, and mindfulness. Those are three areas that we focused on in that additional coach training, and we also asked the coaches to try to also emphasize in their coaching style with the clients eventually. So it was a pretty extensive concern for defining and also training our coaches. All right, so then we go into this 3 to 6 months of coaching with our employees, and here is what we get for results when we add coaching to a pretty good wellness program here at Ithaca College. First, take a look at how our employees participated in the coaching process. It was really quite good. We had about, for every 3-month period, anybody who was assigned to work with a coach had about 9 sessions with their coach. And I forgot to mention that each one of these sessions lasted from 30 to 35 minutes. So they all pretty much had about 9 sessions anytime they were expected to have a weekly session over the course of 12 weeks, which means they had 9 out of 12 sessions. So there were some canceled sessions. However, we thought that was a pretty good adherence rate for asking for a once-a-week type immersive coaching program. We thought that was necessary because, again, this type of study, a random control trial with a variable like coaching, we wanted to hit the coaching variable as hard as we could. So the coaching participation was very good. However, when we look at what happened results-wise, we saw an extremely great effect of the Mind, Body, Me program. Our wellness program improved some of the biometrics characteristics, improved their health risk, their overall health risk appraisal, improved their fitness levels as self-described, and also their participation in fitness, improved their nutrition as well as self-described. There were some variables that did not change. Waist to hip ratio did not change. The blood variables, glucose and LDL cholesterol, did not change over time, but the majority of the variables were impacted by the wellness program, were positively impacted by the wellness program. When we looked at the effect of coaching, and remember now we're able to separate out coaching because we have this control group who did everything involved in the wellness program at the same level the coaching groups did, except they didn't have coaching. So now we can compare the wellness program with and without coaching, and that's where we look at these group by time interactions. Which group are you in and how did you perform over time on various outcome measures? And we saw blood pressure to be particularly benefited in the groups that had coaching. And if you take a look at the little figure there on the side, you can see that the control group, which is the solid bar in the middle, it's a dark color in the middle there, you can see that those folks benefited from being in the Mind, Body, Me Wellness program. They had a decrease in their blood pressure, and pretty much over the course of 6 months that decrease was maintained. However, the interaction shows that the decrease in blood pressure, and this is systolic on this graph, the diastolic blood pressure graph is rather similar. You can see that there's also a drop in blood pressure, and the drop is greater in the group that received coaching, and that is also maintained at the 6-month time point. Oddly, the group that was receiving weekly coaching for 6 months took a little bit longer for their blood pressure to come down, but it came down just as far as anyone else's in the study. So coaching seemed to have this sort of unique effect on blood pressure, whereas our wellness program was very effective in improving overall health. When we looked at other variables like body weight, like fitness, like resting heart rate, like nutrition, the coaching effect was not evident. Only the overall wellness program effect was evident. So as we start to try and interpret and explain these results, we conclude that this Mind, Body, Me Wellness program is extremely effective, a very highly effective program. But don't forget, this not only included coaching, but also included exercise programming. And when I say exercise programming, not only that our folks had access to a gym, they had access to group exercise classes, they had access to personal training. All this was part of the benefit package for them while they were in the program. They had access to yoga, massages, they had access to information about good nutrition, lectures on nutrition, weekly emails about various health-related topics. So the program was an extremely comprehensive wellness program that also included coaching. And the program was very effective. However, when we looked at the isolated coaching effects, taking it out of that program, pretty much our blood pressure impact was all we really had to say coaching improved. So, you know, what you're looking at here is trying to insert a coaching impact on a program that's being delivered to a population, a contained population that's being very well inundated with information about wellness, not coaching, but information about wellness from the HR department. And those folks participating at a high level, remember these are all volunteers for the program, they wanted to do something for their wellness, so they were ready to do something. Even the control group was ready. And they did, apparently, all follow through very nicely and improve their health, such that coaching just wasn't able to add to that effect. The effect of the wellness program was probably too strong for coaching to do much more than simply improve systolic blood pressure, which is a great impact, but we were hoping certainly to see coaching have a more widespread impact on some of those variables, and I think our design of embedding it within such a good wellness program probably was sort of our undoing. We probably should not have had such a good wellness program, darn it. So I think this variable that we oftentimes work with related to the trans-theoretical model, readiness to change, is a really important coaching tool and worth mentioning. We did see readiness to change, and I didn't mention this in the results, but we did see it very highly related to, and those growth latency curves showed us that readiness to change was very highly related to a lot of the baseline measures people who are ready to change are actually in much better health than people who report low readiness to change or are in the pre-contemplation or contemplation state. Folks that are actually moving on their change or ready to move on their change of behavior to improve wellness happen to be in better shape. And that's a little bit of an unfortunate situation. We'd sure rather have people who are not in good shape and not really in great health be more ready to change, but that doesn't seem to be what we found. And so using this measure, readiness to change, might be extremely useful for coaches. I'd also like to point out that we did see a difference between men and women in readiness to change. Most of our findings with readiness to change were in women. So women who were reporting a high readiness to change, either in a going to change soon or in the maintenance stage, those folks actually had much better health. And so that's something for coaches to keep in mind, but only in women and not so in men. So maybe men who are indicating they're ready to change are willing to say that even though they're not in good shape or not really in great health. So I think one of the main takeaways from folks in the audience who might be researchers is that doing coaching research is challenging. I think sampling and doing random assignment is a very difficult process in coaching research. I believe that when you recruit a sample, one thing, if they're not, if in our case they were signing up for a wellness program and we told them coaching was part of the wellness program, and at that point they first heard that, oh, I'm going to be doing coaching, and most of them accepted that very willingly. But there were some folks who I heard and spoke to, so this is all outside the data set, but there were some folks who were not very happy with having to do coaching, and they were assigned to one of the coaching groups. So this random assignment to folks who are not fully aware or not coming forward and saying they want coaching, they're volunteering for coaching, is sort of a tricky business, because you do end up with some people who might not be accepting of the coaching process. And though they might do it, and they might do 9 coaching sessions over 12 weeks, they might do that somewhat reluctantly and never buy into the coaching process, and so that can hurt. Or if you looked at that one little table that I had, they might be on the low end of adherence and only be coming into 3 or 4 coaching sessions over the course of 12 weeks or more. And so when you're doing this random type experiment and you're assigning people randomly to these coaching groups, it might be better to only start with people who have already knowledge about the coaching process, and not only that, also have accepted and they want the coaching process. And I think much like Alyssa's design, where only people who came forward who wanted coaching is where she had her starting point, I think that might make more sense than in an employee setting as I was in, where we did a much larger human resources sort of organized project. You have some potential for differences in how those folks come to the coaching process. So I think alternative designs are in order. I do like the waitlist control design. I haven't seen any, but I would like to possibly in the future not only see other folks, but myself also, be doing maybe more of a sham coaching design rather than simply a waitlist coaching. Have a little bit of deception in those first maybe 3 to 6 months of coaching, where a group is actually given some counseling or education of some sort, meeting with a person who they believe is doing coaching, but doing something other than we consider coaching, at least as we systematically defined it today. I think that might be an excellent design, but I haven't seen anything that uses a sham coaching model put forward yet. I think the other last piece about research that's worth mentioning is that we need to develop a large practice-based network where coaches, all of you folks that are listening who are doing coaching, actually provide us with data. All right, I'm running a little bit short on time, so let me just say to folks who might be in a position to work in a wellness workplace that depending upon the type of program that you put together, our Mind, Body, Me program was so well done, I can only say it that way, that coaching might help some of the folks, and certainly a lot of our people have attested to, and we're doing some qualitative analysis now as well, have attested to how much they love coaching. When you look at least the hard numbers, if you're running a large workplace wellness program with lots of access to different kinds of interventions, then coaching may or may not help the majority of people. On the other hand, if coaching is all you're offering to your employees, that's a whole different model, and I'd be very interested to see how that works out. From a coaching practice standpoint, I'd like coaches to be very well aware of that, understand what is available to their clients, understand if they're employees and if they're in an employee wellness program, and how the coaching piece might fit into that whole larger intervention, that larger health intervention. And I'd also like to mention, again, the importance of using maybe readiness to change. For those of you that don't use that, it might be an important tool to use. As far as dose of coaching goes, we didn't see any differences between our 3-month weekly and our 6-month weekly coaching interventions. So you might take from that 3 months of coaching is as good as 6 months of coaching, but again, our findings for coaching in and of itself were not robust enough really to make a whole lot of statements about the dose of coaching. So I think there's more work to be done on dose of coaching. We'd like to say that our coaching practices are evidence-based. We'd like to say we're practicing an evidence-based health care model. And in fact, I think we will have some proof of this on a large scale in the near future. But right now there are definitely some questions. I feel very confident to say that the coaching profession has a lot to offer. I do think the research process, however, still is kind of struggling with how to figure out how to wrap its hands on exactly what coaching brings to the table within the healthcare model. So I do believe you haven't seen anything yet. You are going to get this proof positive, but we do have to we have to all realize as coaches that there is going to be a scope of practice. We're not going to help everyone in every situation. However, we are going to be very, very important to a lot of people in many situations. So with that, I thank you all for listening. My email is there. If we don't get to your questions today, if you have any questions, feel free to email me, and I'll turn it right back over now to Irina.
Thank you, Gary. Thank you very much for the very interesting presentation. And it really, I think, will be helpful going forward for employers to be thinking about that, and employers and coaches also thinking about how to maximize their wellness interventions and choosing different approaches or combining different approaches. I think this study really shows the details about how they can be combined and the impact of both coaching and wellness programs, as well as the dose of coaching that you talked about and how that matters, or at one point some kind of saturation maybe is happening. And I'll also turn now to some questions from the audience, particularly for your presentation. We have one question about what are your thoughts about why particularly blood pressure was reduced, and maybe what led to that? What are the mechanisms behind that blood pressure reduction, specifically with the coaching?
That's an excellent question, and one answer to that, it might be that coaching, and remember we're talking about here only the coaching effect, might have impacted many of variables, but at subclinical levels where we couldn't necessarily see the coaching effect. So there was a body weight effect, a body weight drop of all of our participants overall in the Mind Body Me program, but there might have been a subclinical coaching effect on that body weight that we couldn't measure. It just wasn't powerful enough. And if you look at the possible impact on things like body weight, maybe on stress management, maybe on other important variables that are related to blood pressure control, it could be that all of these effects of coaching, which we weren't able to put our hands on statistically within our model, combined kind of in a synergistic fashion because blood pressure is so sensitive to all these. So one speculation is that blood pressure is a sensitive measure that was able to sort of come forward. But that's speculation. You can also look at our design of our study, and we have so many outcome variables that maybe you're going to say, hey, if you do statistical analysis on that many variables, you're going to find something that's significant. And in fact, that might be also another way to explain why blood pressure, well, systolic blood pressure, but you know, the fact that both systolic and diastolic were significant, those are obviously two different variables, and they both show significance. We've also reanalyzed the data by many different subpopulations. We've looked at it by people that are at high risk and versus low risk, and we still come up with the same variable. It seems to be blood pressure was impacted by coaching in this group. So I like that speculation of coaching having a lot more effects than we were able to tease out, and blood pressure being the one thing that came to the front. But of course, that's just my guess on that one. Thanks for that question.
Thank you, Gary, for the response. And I'd like to open it up now to more general discussion and maybe some intersecting points between the two presentations. We do keep getting more questions, and I'll try to both summarize some of the questions and start it out by asking about, both of you did follow-up on your original studies, and both of you used, for example, qualitative methods to do that follow-up and are planning additional follow-ups. And so I was interested in, some of the people in the audience also are asking about that, are interested in some of your thoughts about what that has added, particularly the qualitative in-depth work that you've done. For example, for Elisa's presentation, there was a question about the identity work that people have been doing in your additional studies that you talked about, and in both of your presentations really talk a little bit about what you're doing now in the next steps.
Go ahead, Alyssa.
Yeah, maybe Alyssa, if you'd like to start.
Okay. Sure. So yeah, I think the qualitative data gives us a richness that can help kind of round out what we find in the quantitative findings. We kind of, like I said before, it puts kind of a human face on it. I know that Joy, my colleague Joy, and I learned a lot from our analysis of the qualitative data, and we hope to do more of it as well. We transcribed the exit interviews. We also audio recorded a number of the actual coaching sessions. So we have just a wealth of data to draw on, and much more work to do in that area.
Our qualitative data are actually coming through right now. We interviewed about 24 of our employees who volunteered to be interviewed. Almost to a person, they were extremely satisfied and just lauding the coaching process. So I mean, it's a little bit biased in that sense. We also interviewed all of our coaches, all 13 coaches were interviewed, and that's actually the data we hope to report on first. And what we're trying to mainly get a handle on there is what's over this relatively long course of coaching intervention, what strategies did they rely on the most, which ones did they use every day versus which strategies did they use periodically, and we think that will be valuable information for the coaching community, because we're all expert coaches and we'd like to sort of share what they did with the coaching community, and I'm hoping that we have some of that data very, very soon, and actually looking toward maybe presenting that in Boston at the American College of Sports Medicine's national meeting in June next year.
Okay, and maybe at the coaching conference too.
Sure, of course.
And also please, yeah, right, also in Boston. Please continue to give us your questions, and we will try to answer all of them either now or later on. And coming back to that idea of longer-term impact, and again, some of the questions address this. You were both, you're both thinking about that, and I was wondering specifically. So, for example, in Alyssa's study, some of the outcome variables that you addressed were not impacted; those were job-related. While the more individual ones were impacted by the coaching. How do you see that in the longer term if the coaching continues further? And a similar question, I think, for Gary is you show how the combination of wellness and coaching plays out. What are your thoughts about maybe coaching as a sustaining approach? I'm not sure how long the wellness program is, so maybe you mentioned that, or does it end, or is it ongoing? So those longer term impacts or effects of the programs, if you could talk about that.
Yeah, well, I was really happy to hear that Gary had been looking at dose of coaching, because that's something that I've been having a question about from the start of this, is what is the optimal length of coaching, and particularly if we're hoping it's something that companies will pay for, we need to make sure that it has a benefit. It has to be long enough to have a benefit, but not too long, because it's expensive the longer it gets. And so I don't know if I can answer the question based on the research that is out there in terms of what would happen if we continued coaching for longer in my study. And I guess I would say that we could follow people for a longer term after the study ends, and it's possible that some of those changes to the individual personal well-being effects might translate into changes about how people feel about their jobs in the longer term. Because if people are feeling more confident and better in themselves, they might reach out and make some of the changes that would make their working situations better for them, and would in turn make them more satisfied. So I think that's a possibility and something I'd like to look at in the future.
Mm-hmm.
One very neat aspect of Alyssa's study was that she did do that follow-up 6 months later. And that sort of indicated that the coaching effect had staying power. It was robust, and it hung around 6 months later. So
yeah,
it's sort of a not exactly to your point, Irina, of how much more coaching can we do after it's over, but how long does coaching last after you finish your coaching sessions?
mm-hmm.
In the case of our project here, now the Mind Body Me has become a permanent benefit for the Ithaca College employees, and so they have access to always have access to those same different health interventions. They also have access to coaching, but on what I'd call a much smaller scale. And this speaks to something that I'm sort of concerned with in terms of the coaching profession going forward, and I also think needs research, and that is kind of differences in how we deliver coaching out there these days, and the quality of coaching that's being delivered. Because we now have access to coaches who are no longer the 13 well-coached trained professionals that we had in our study, and coaches that are sometimes employed by large organizations, healthcare organizations, third-party payer type organizations, sometimes have such a heavy schedule, and sometimes their training is not as we systematically define it as a patient-centered, relationship-developing type process. Instead, it's more of, I've got 10 to 15 minutes to talk to you on the phone before I have to call my next client. And the coaching impact then, if that is the kind of product that's available long-term, I'm not so sure how helpful that'll be. It certainly begs for more research on the one hand. On the other hand, your gut would tell you that seems to be an inferior product.
Okay. Well, thank you very much to both Alyssa and Gary, and thank you everyone for all your questions that you have sent to us in the last few seconds that we have of the webinar. I want to also thank both presenters for these thoughtful designs, research designs that expanded our understanding of how coaching works, and what we can take away in terms of recommending to employers and internal and external coaches and their thoughts about sustaining well-being in the workplace. And I was also very happy to see how the research coming from the Harnisch grants is also being expanded and serving as a springboard for further research. Thank you everyone for participating today. And I'll turn it over to Stephanie.
Wonderful. Thank you so much for everyone again for participating today and for our great presenters. There are definitely a lot of questions that are left unanswered, and I will certainly share these with our two presenters today so that they can respond at their leisure if they're able to do so. Thank you so much, and everyone have a wonderful rest of your day.
Bye-bye.
Bye, everyone.
Bye.